AskReddit. Doctors of Reddit, what was your dumbest r/iamverysmart patient experience? RN here. I see some crazy stuff, but one thing that stands out was the time I was admitting a guy to the hospital. I can't really remember what for, but he was about 400 pounds. Diabetic heart disease, you name it. Anyhow, I'm at the computer going over some admission questions with him and his 10 family members who are crowded in the room with him. A few minutes in he starts complaining that he's thirsty. He needs something to drink right now. So I get on my phone and call the nurse assistant and ask her to bring in some ice water. As soon as the words are out of my mouth, the whole family screams no water. He's allergic to water. Well, this is gonna be a problem. Turns out the guy had been drinking nothing but Sprite and sweet tea for years because of his water allergy. The next question the wife had was, where are we all supposed to sleep? The whole family, 10 people, were planning to stay at the hospital with him. You can't make this sharp. A related story from my friend, a gynecologic oncologist. Basically, a woman had early uterine cancer, but refused surgery. She wanted to explore alternative treatments like coffee enemas and meditation. She somehow managed to get an audience with the Dalai Lama, who told her to go back to Western treatment. I'm a dental student. One patient in particular is pathological liar. During one visit, they claimed to have gone to medical school. Next visit was that they did dental army. Last visit was that they had a PhD. The patient will say things like, "Hey doc, do you need me to move my head mesial or distal?" "No. I need you to move your head right." "Hey doc, are these cavities being caused by the anaerobic pathology microbes?" "No. They are caused by you eating snacks all day and not brushing." 80-plus-year-old patient who was declining with multiple diagnoses and about 3 decubitus ulcers. Daughter was adamant that her father be kept on his strict paleo diet because that would supercharge his healing. She had a stack of diet books. He simply wasn't getting enough nutrition to heal the ulcers. He didn't like the diet at all, by the way. At some point you kind of have to stop being polite and just tell patients/family members bluntly that you don't have time for this and what you recommend, and they can do what they want, and just document everything. It happens a lot, but she sticks out all the time. I'm a veterinarian, and I can't tell you how many clients want to explain to me that their pet's illness can be fixed if they are fed a raw diet, grain-free diet, fish oil supplement, etc. Sure, whatever. Come back to me when your dog's huge mammary mass ulcerates and starts leaking pus everywhere, and we can reevaluate how well her raw diet is working to fix that. This one happened to my ex-father-in-law, and it's funny, but it's not. He was a surgeon, very gentle, soft-spoken guy, and came out to tell them the biopsy results, to which they responded, "Praise Jesus, it's malignant." He had to explain that malignant meant bad. RN here, not a physician, but you may find this interesting. Young adult male presents with multiple abscesses on various parts of his body. States he injected his boyfriend's semen into himself trying to get pregnant. He tells one of the APCs he should have gone with his original plan and tried on his dog first. Psych clears him. He's admitted to the floor and gets IV antibiotics. What? Oh boy, it's my time to shine. A guy brings his wife to the ER. Her leg has a 7x7 cm wound diabetic ulcer with greenish yellow pus and what looked like a few maggots. Now I took one look at her and referred her to the surgery department for admission. But the hubby is adamant on his wife's kidney disease. "But doc, it's just a wound. You gotta fix her kidney first, doc. I read online that diabetes can cause kidney failure and you gotta do something for that." I spent an hour convincing him that his wife would probably die before the kidney damage sat in by sepsis from the clearly infected wound. Optician here. We had a patient who refused to let us use the tonometer, a machine for checking ocular internal pressure to diagnose glaucoma. He said that puff machine gives you glaucoma, and we weren't going to pull that on him. He told us his father got an exam and had glaucoma after using that machine. His uncle and brother also had no signs of glaucoma, and after getting the puff test, both people had been diagnosed with the disease. Glaucoma doesn't have any outward symptoms before you start going blind. This dipsh just told me he has a very strong familial disposition to glaucoma and refused to be tested for it. Not a doctor, but a patient whose mother was like this. The doctor had to speak to me on the side because of it. My grandmother has Crohn's disease. Very badly. It skipped my mother and her brother. When I was 15, over the course of 6 months, I went from being 5 feet 9 and 190 pounds to being 110. I was a skeleton, extremely anemic, and coughing up blood. My mother was convinced it was something else. I forced her to bring me to a doctor and she spouted off all these possibilities. She then talked about what she yahooed, not even googled, Yahoo, about genetics and such. And Crohn's can't skip generations. Well, the doc said just in case, we are gonna run some tests. Long story short, I have Crohn's in my throat and small intestine. So does my cousin. It just skipped a generation. I work for an optometrist, and it was a month before school started, and a woman brought in her son to have his eyes checked for the first time. Seems like a pretty reasonable thing for any parent, even if he was a little older than usual for a first eye exam. Better late than never, I guess. The mom was well spoken and appeared fairly intelligent. Everything went as normal. The doctor examined the boy and ended up prescribing glasses. When the doctor was explaining to the mom that her son had to wear his glasses all the time since he's nearsighted and basically can't see clearly past 5 feet in front of him and will definitely need glasses for school. For some reason this caused a switch to flip in the mom and she spazzed out on the doctor, saying that her son doesn't need glasses and that the doctor is only saying that he does because he wants to sell glasses. She says that she only brought her son in because there was some form for school that needed to be filled out and that doctors are all con artists trying to push unnecessary medications and interventions. The doctor tried to calm her down and explain that he's only trying to help them, but that she was free to get a second opinion and gave her a copy of the kid's prescription and sent them on their way. About 4 months later, the lady is back asking for another copy of her son's prescription. Apparently the first semester midterm results were in and her son failed them all because he couldn't see the board in his classes and needs glasses. Had a young woman with recurring UTIs that began after a recent partner and with no STDs, went through the standard questions trying to figure out what could be causing them and eventually found out she had been lubricating with jelly, not KY jelly. The mix-up had literally been a joke on house. It took me some effort to keep a straight face, but we eventually resolved the problem and she stopped getting UTIs. Oh, I have 2 good ones that come to mind. Clinical pharmacist here, by the way, with one story in the ER and one in the pharmacy. ER physician told me this one. 16-year-old boy presented to the ER with an extremely swollen discolored penis. Apparently he has been using his mom's insulin needles to draw blood out of his arm and inject it into his own penis. He thought that adding blood would help increase his size. His penis was terribly infected and he was hospitalized for a week or so. One day in the pharmacy, a girl comes to the counter requesting a refill for her birth control. We pulled up her profile and realized we couldn't refill it because she just got a 28-day fill less than 2 weeks ago. When we asked what happened to the other one, she said she was out. Apparently, both her and her boyfriend were each taking a pill each and was adamant that was how they needed to prevent pregnancy. I've got 2 stories that stick out in my mind. The first is the mother of a toddler who came into emerg. The kid had cruddy green/bloody stuff coming out of his left nostril and a lot of redness and swelling of only the left side of his nose and the adjacent cheek. Mom was sure he caught a sinus infection and just wanted some antibiotics. Now I know some kids like shoving whatever will fit into their body orifices and that this was more than likely given the one-sided nature of his condition. But mom was insistent that he never puts things in his nose. It took some convincing, but I finally got her to let me take a look. Gave a squirt of midazolam in the good nostril to settle him, then dug with some tweezers through the crud until I pulled out a big old button battery. It would been burning his nose for a couple days. Hopefully he healed up well. Side note, if a kid swallows a button battery, it can do a similar thing to their esophagus. This is an emergency and needs to be dealt with as soon as possible. My dad is an emergency nurse. He experiences the same thing doctors in the ER do, maybe more so, because he's the one in the rooms more often. Anyway, here's a good story from him. I had a patient come in with several pages he printed off the internet. He kinda slammed them down and said, "This is what I have." He had bloating, nausea, vomiting, diarrhea, bloody stool, and fever among other things. He insisted he had schistosomiasis. He was being a real jerk about it, like we are wasting time, since he already knew what he had. So, I asked when did he get back from Africa? And he said, "Africa? I've never been to Africa. What the hell would I be doing in Africa?" I proceeded to tell him that schistosomiasis is a parasitic disease one gets while swimming in the Nile River or other rivers in developing countries like in Southeast Asia. He got angry at me because he thought I was being a smartass. He got seen and diagnosed with gastroenteritis, the stomach flu, the bloody stool. He had hemorrhoids. You have been visited by the great burb of capitalism. Many seeds will come your way, but only if you comment. Good job, Mr. Burb.